Information technology is increasingly being used in healthcare, and these platforms have shown positive effects on both patient engagement as well as health behavior change. Looking at this week's article, researchers completed a systematic review of various studies that measured the impact of these IT platforms on healthcare outcomes and healthcare costs. Although they saw that there were positive outcomes and lower costs, these studies did not specifically identify what drove these changes. Therefore, the main purpose of this study was to draw conclusions regarding the effectiveness of various platforms and what components can result in the most meaningful behavior changes and intervention. What researchers did was they took studies from PubMed, Web of Science, PsycInfo, and Google Scholar to have a wide variety of sources for these articles. I believe that the researchers set specific criteria on whether to include or exclude certain studies in their research in order to have the best sample and to base their conclusions off of. Additionally, by having these two independent investigators review the studies based on specific criteria, I think this allows for a more comprehensive review of the findings.
The authors assess the impact of IT on health outcomes, effects on patient engagement, whether the studies used behavior theory-based interventions, how researchers measured health outcomes, and whether they assessed the usability of the IT platforms. I learned that IT platforms greatly improved health outcomes and patient engagement in a majority of the 170 articles in meaningful ways such as bringing down A1C levels in diabetic patients. The authors categorized the interventions as internet, phone, video game, social networking, or telemonitoring based. However, the demarcation between these categories is unclear, since, for example, some interventions can arguably be simultaneously phone, internet, or social media based. Another concern is that over 50% of the intervention studies were classified as internet based. I think that more studies on the other types of interventions are necessary to come to any meaningful conclusions. To illustrate this point, the authors found that 100% of video game interventions were found to positively affect health behavior. This was based only on 6 studies, whereas the authors used 86 studies to assess internet-based interventions. Based on this study, I would recommend IT interventions be created using behavior change theories and with usability in mind, since these two factors seem to improve patient engagement and health outcomes.
Researchers here at UCI have created a low-cost disposable wearable respiration monitor. The wearer can use a mobile application to then monitor the data received from the wearable in real time. As a public health policy major, my mind immediately goes towards understanding health at the population level. I think it's an important exercise to imagine where this and similar technology and in combinations of these technologies may lead us in the future. A technology like this respiration monitor combined with a sensor to analyze, say, carbon dioxide, could be used to help populations understand their metabolism. There's a concept in the field of HIV/AIDS research called community viral load, which is used to better inform a response to this epidemic. With the use of this technology worn by whole communities, the concept of a community metabolism could emerge to also help in this nation's struggle with poor nutrition and obesity. Another avenue I can imagine for use of such wearable technologies with continuous monitoring is within times of crisis, such as the ongoing example seen in Flint, Michigan. Imagine a wearable technology that can monitor blood lead levels. Such a technology could be disseminated to residents of a community in such a crisis. This would increase the sense of control and trust in local and government health officials many residents of Flint felt has been absent in this progression of the crisis. Offering a way to identify if a person has been exposed to lead would have done much to add clarity to this ongoing crisis. The possibilities of this technology and all it has to offer are many and yet mostly unimaginable.
The article discussed a new wearable tech that can be used to monitor an individual's breathing in real time, and it would primarily be used for asthma patients. The sensors would be attached to an individual's ribs and abdomen and would feed information to an application on a mobile device that would detect subtle, random, and significant changes in breathing, thus letting the user know about an impending asthma attack prior to the actual attack. While this idea is solid, a low-cost way of manufacturing this idea had not existed until Michelle Keane developed a solution to this issue based on a decades-old children's toy called Shrinky Dinks. On top of this, she wanted to add a new element to it that utilize crowdsourcing to gather information about allergen-heavy areas, thus warning parents about these areas before they take their asthmatic kids out. This entire creation builds off of our conversation about the utilization of wearable devices. They are not just limited to monitoring general health, but rather can be targeted to predict and warn about specific problems before they occur. And overall, it's a massive step in biotech to a more proactive approach rather than a reactive approach.